Sit for Pat.
Nice doggy.
I know.
So what's going to happen today, Jake?
What are you here for? Come on, don't be shy. Are you shy? He's almost 10, and he's really good at having acupuncture, which is great for dogs. And Dr. Ortenburger is going to do a demonstration on what he would do if he was going to treat Jake in the real world.
Oh, I'm going to treat Jake. Jake's getting a real treatment. Getting a free treatment this morning.
Yep.
All right, let's go on in.
First time the animal sees me, they don't know who I am. I'm wearing a white coat. They have every reason to be on their guard, and often they are.
Right, they're out of their element, yeah.
Absolutely. And so I'll bore them. I'll start talking with the owner, ignore the dog or cat. The leash is off. They're free to walk around the room, and they just hear my voice droning for 10 or 15 minutes while I'm trying to understand the full history of the animal and what its problem looks like to the owner at home, because I can't see that, and how it's changed over the months and years ahead or behind. And when the dog's heard me like this and nothing's happened for 10 or 15 minutes, we all get down on the floor, unless it's a very small dog or a cat. We get down on the floor, and they're ready to be friendly. And the fact is, what I do doesn't really cause much pain. In fact, usually none at all. It's a little hard to understand how acupuncture doesn't hurt. We're putting needles in, and most of the time it just doesn't at all.
Well, I think we're going to have an example of that right now, because we have a patient that you've made a connection with, a 10-year-old. What breed is Jake? We have a 10-year-old mixed breed, Jake, who's here, and this is one of your patients.
Yes, Jake is kind of a terrier cross, 9, almost 10-year-old. Yeah, wiry hair coat. I'm pleased to say is a Humane Society adoption, and he is very, very happy with or calm about acupuncture.
Sniffing around our studio
Jake is
right
here
now
with
with his owner, Marty Hobson, who's helped us put together this series. We appreciate that, and Jake looks very happy to see you, Dr. Ortenburger.
Just watching him, I was lagging behind a bit when you came through the outer room. I thought left hind, possible. We'll just go with that, and other things that well, he's not geriatric. Jake's in good condition, but I do get to look at his teeth. Oh, great. And claws and hind. Okay, Jake. We all right?
How do you think acupuncture will assist with Jake here?
Jake is not an old dog. Jake is coming 10, and he's going to be old soon. He probably unavoidably does have some very mild arthritic changes in various joints. There are some in dogs that we expect, that we know about, are fairly often encountered. And we can actually use acupuncture in a preventative sense sometimes. Probably don't do a lot of that, but it can be done. And it's interesting when people when clients do ask, how does acupuncture work? Very, I think, obvious and very good question, probably the best question. There's two approaches to answering that, and one can be from the view of conventional medicine, of anatomy, physiology, and that sort of thing, and neuromuscular responses. But another response can be in the Chinese terms, and we find very often there are people who would like to know about these things called qi and yin and yang, and what acupuncture is doing to influence those and change the dog's state of health. If you want to see that, you can just
there it is. There's
it's a throwaway, of course.
And we should say you're down on the floor with Jake right now, and one needle has gone in already?
Put one near the top of his head. It's a point that sort of connects the left and the right half of the body. And we'll do a few things here for that left hind leg. Don't have any x-rays here in the studio, but that's all right. And
should say Jake isn't even noticing what you're doing right now. He's very content.
It's interesting that while they may not, in fact, usually don't feel any pain with the needle insertion or manipulation, we'll do a little later, they do change. They're I don't know, it's the look in their eye, their expression. They know something's being done, and they know it's having an effect on them internally, And who knows? I mean, if we find somebody that's had acupuncture, they can describe to us maybe what that feels like. Get the needles in first and then do the manipulation when they're sort of all in place. Yeah, that's a boy. You're being good. These are, though. That's why he's here.
Very content.
But we could have used many other dogs for this there.
How many patients do you have on a regular basis? Because I know you're teaching as well, but...
Yeah. Boy, that's a pretty basic question. I should have a pretty quick answer for you, but the fact is, there will be, I don't know, a couple hundred animals out there that at any one time I might see once a year or once a month.
Okay.
And it's kind of an interesting distribution between cats and dogs and horses and the odd other thing.
Like? I want to hear about the odd other things.
Oh, a cow now and then. Okay, let's do spleen 6.
You can do acupuncture on rabbits, birds.
Reptiles?
Reptiles.
Really? Okay.
Dolphins.
Dolphins.
There's a researcher, I think University of Florida, who's mapped basically, since this was nothing the Chinese had ever done, at least as far as we know, had mapped and can tell us quite a bit about acupuncture point location on dolphins.
My goodness. So how many needles have gone in so far? Because Jake has not even flinched. 5 so far.
We've got 3 on the left hip, kind of up high. There's a major nerve that runs under there. 1 on the head, 1 on the right hind leg, just above his hock or his ankle.
And Marty, do you notice a difference after treatments? Jake?
I do when I see it in other dogs. Jake's always pretty calm, but I'm sure this will make him feel better. But lots of dogs with back pain and hind leg pain seem very relaxed, and the owners tell us that they definitely notice a difference after the dog goes home, that the next day they're able to walk to the end of the driveway when they haven't done that in months, that the cat is now jumped up on the counter and hasn't done that in years. So I'd say the majority of times owners really notice a good benefit.
Yeah, that's a good boy. And so often at this point, where the needles are in and the excitement is kind of over, although as you saw, there really wasn't any excitement to that at all, and Jake's just sort of looking around.
Very mellow.
Pretty mellow. Some animals, especially the smaller breed dogs, I'm not sure why, they'll start to take a nap. They will get not exactly sedated, but they'll get very quiet. Some actually will appear to go to sleep. And they stay that way for most of the rest of the day. And the next morning, they're back to their normal self, unless, as we've just heard, they may be more energetic. They may be doing things they haven't done for a long time that reflect greater mobility, greater comfort, things like that.
He's stretching out right now. He's just chilling on the floor of the studio. Marty was saying, but have you heard those stories as well? I'm sure you have, Dr. Ortenburger, about, my cat or my dog is doing something they weren't able to do before this procedure? Yeah, that's one of the first things that people seem to notice, that I hear, not on the first visit, of course, but on the second visit, or it might be the third or fourth, that they'd forgotten that their animal had characteristically jumped up, say, the first 2-3 steps getting into the front door of the house, that they just were accustomed to the dog now walking up 1 step at a time. And they, we do the first acupuncture treatment, maybe the second one, and they go home, and the dog, goes back to that older habit of leaping up the first 3 steps to the house, or up onto the couch or something like that. Those are very common reports from the owner, which are helpful. We know we're on the right track. And they also describe response to therapy that immediately says, okay, we can take this up to the best level they'll achieve and stop. The least therapy is the best, in my view, and when acupuncture has done all it can, it's time to stop. And then the months go by, the owner will just see a slight backsliding, just a very slight, always slowing down and not able to get up quite as smoothly in the morning as before. And okay, they call and we do 1 more treatment at that point, and that will be the beginning of a sequence of a regular period between treatments. It can be as infrequent as once a year. It can be as often as once a month.
So if people decide this is something they would like to explore, Dr. Ortenburger, what would be your advice? How can they get in touch with a practitioner?
Well, really, the best avenue is certainly to start with the regular veterinarian, the family doctor for the animal, so to speak, to ask about that as an option. And they might be told, they might understand that the particular medical problem the animal has doesn't really lend itself to this, or they might be told, yes, that's an option, and we can look into it. There are, I think, 4 veterinarians on PEI who use acupuncture. There are 3 of us using chiropractic manipulation, and I don't think we have anyone using osteopathy, and I'm not aware of anyone using some of the other systems of medicine that are slowly being brought into animal medicine, as they have long been available for humans.
Well, Dr. Ortenburger, and look at Jake, he's happily getting scratched behind the ears right now and lying down. Dr. Ortenburger, thank you so much for coming in here today, and Marty and Jake as well. I really appreciate all of you coming in.
Well, thank you, Matt. It's been a pleasure.
I couldn't look at this guy. That was wonderful. You're good at this, Art. Thank you.
Yes. Well, Jake's good at it too. Yeah.
There's the last one, so you can see how tiny they are.
Very fine and flexible.
The silver part.
Yeah.
It's going to clean up the mess here.
Yeah, well, no, thank you. Can you help?
Yeah.
Down. Doctor.
Look at
Good
this.
boy. Good boy. Good
I
doctor.
put my 3-year-old named the